The brain is the least understood organ, and yet is the very important organ because it literally runs our lives. Welcome to Mind Vault Podcast, where we unlock minds one story at a time. I'm your host, Dr. Clementine Chawane, and I'm looking forward to having thought-provoking conversations that will help you and your loved ones with regards to mental wellness and building resilience. Welcome to another episode of Mind Vault Podcast, where we unlock minds one story at a time. I'm your host, Dr. Clementine Chawane, and I'm looking forward to another great conversation where we help you and your loved ones understand mental health and how to build resilience. We're going to be spending a few episodes on introduction of the mental health disciplinary team, what we call an MDT. And this was inspired by the fact that most people tell me, I know what is the difference between a psychologist and a psychiatrist, but I don't know who to see when. And so I thought that as we dive into our podcast, it will be great for people to understand the different roles that are there in mental health. And so to start off the show, with our guest, because I'm not actually the formal guest, is Dr. GS Matsebula. He is a psychiatrist in private practice, and we share the same passion of helping people understand mental health well. So I'm going to actually be reading out his bio because I don't want to mess it up. And I think this is good because it's a professional bio so that you know that he's actually qualified to be speaking on this topic. So Dr. Matsebula is a psychiatrist in private practice with a deep passion for mental health promotion. He is a director of Mental Health Med Incorporated, which is an organization that is dedicated on raising mental health awareness and providing practical tools for managing stress, anxiety, and burnout in a corporate setting. That is very special. He firmly believes in the power of education and storytelling to break down the stigma, foster understanding, and inspire action towards mental health for all. All right, so there wouldn't be a better guest than him because we share the same passion on challenging the stigma through awareness and education. All right, and so Dr. Matsebula, thank you so much for coming. I really appreciate all the efforts that you have made to be here. I know that you've made lots and lots of sacrifices. Psychiatrists are often very busy, and you're also a family man. And so I really appreciate your time here. So welcome to our podcast.
Thank you so much. It's really great to be here, and really thank you as well for bringing us together, for bringing this podcast together. I think, as we were just speaking off air, that there's a lot of information that is out there, but a lot of this information isn't coming from us as specialists. Yeah. So thank you for having me, and thank you for all of this. I'm looking forward to it.
Great. Thanks, Gagu. And so I'll be referring to him on first name basis because we're colleagues and we prefer, but he's a doctor for all of y'all. So for me, it's Gagu, right? So Gagu, what inspired you to pursue psychiatry?
So thank you for that. I think my response is going to be in two parts. The first was seeing the effects of trauma on loved ones in my family. Yeah. So you have the traumatic event, then you have the response of the person, either emotionally or physically. So I saw that, and I also saw how they improved after they started seeing a psychiatrist and they were seeing a psychologist as well. Mm-hmm. The second reason is I've always been interested in how the brain works. You know, the brain is not just this blob of flesh that's inside our head, but it not only controls every aspect of our bodies, but it also controls how we interact with people in the workplace or at school. So I was always interested about this organ. So psychiatry, it was for me.
Is it? So you never doubted whether or not you wanted to pursue other disciplines?
Initially, there was fear in that, as you know, when we undergo our training as medical doctors, we get to see, unfortunately, people that are really, really ill.
Yeah.
So initially there was a bit of fear, but once I started rotating through the Department of Psychiatry and learning about it, the fear went away, and the fear was replaced by interest, curiosity, and a desire to help.
Great.
So here we are.
Here we are.
Here we are.
All right. And so it sounds like the interview that I had last week, so we are sharing the same passion, and so like I just said now, I get asked what is the difference between a psychiatrist and a psychologist. And it's not always an easy question for me to answer, and so I know that sometimes there is no scientific definition, so it will be your understanding about what is psychiatry and how is it different from psychology.
Indeed. Thank you for that. So I'll start off by saying that the both specialities or disciplines, psychiatry and psychology, we both work together for the optimal outcome of the people that come to see us.
Yeah.
So briefly, a psychiatrist is a medical doctor who has specialized in the diagnosis and the treatment of mental illness. And we use multiple modalities to make those diagnoses. It could be starting off with speaking to the person, and then if we need to do certain investigations like taking bloods or maybe doing things like CT scans, where we look at the brain, we use those to help us reach a diagnosis. Then we do whatever treatment is needed.
Yeah.
And our modality tends to be more skewed towards medication. So it could be tablets, it could be syrups for kiddies, it could be injections for other forms. Our psychology colleagues, they don't have to go to medical school. They go straight into psychology.
Yeah.
And their treatment modality is something called psychotherapy, which is a big word for talk therapy. Why is that so important? As you know, in speaking to people, that's where you begin to pick up that this person's manner of thinking is not the healthiest. So that's what they do. They may also help us with certain assessments, for argument's sake. If we're worried that there's something wrong with the person's personality, what's going on, they'll help us with that. And if we suspect that the person we're speaking to maybe is malingering, they're making stuff up because they're secondary gain, our psychology colleagues are going to help us with that.
Yeah.
So briefly, psychiatrist is a medical doctor that went to medical school. Psychologists go straight into psychology.
Yeah.
Some of them, psychologists, will study all the way through to a PhD, and then some of them will actually have the title of doctor.
The doctor.
Yep.
All right, but it's important to distinguish that it's the PhD doctorate rather than the medical degree.
Quite
right? Okay. All right. I think that was well explained, and I think our audience will be able to appreciate the difference. And so one of the things that I hear even amongst us as colleagues is psychiatry science? Is there science to mental illness? Or is it art, or is it something that people go through and it's not scientific and people should just man up and deal with life? What is your take on the science of psychiatry? Is it a proven scientific discipline, or is it a theory that we're coming up with?
Yeah. So sure, you're not playing there, going into it. So it is a science.
Yeah.
And when we speak about science, we're saying we think there's a hypothesis. This is how we prove the hypothesis. And when we've done that, we actually write about it in journals so that colleagues all around the world can also see that, this thing that Dr. Matsebula has seen and is written about, is it really legit or is it a bunch of nonsense?
Yeah.
So psychiatry is a science.
Yeah.
It uses psychiatric principles. It uses scientific principles to confirm what we do.
Yeah.
I really like the second part of your question where you asked about, is it an art as well?
Yeah.
And the reality is, yes, there's an element of being an art.
Yeah.
When we speak about art, we're speaking about seeing the beauty. We're speaking about the possibility, the potential that is there.
Yeah.
And yes, when someone comes to see us, there's science there in that we diagnose whatever the illness is. We do know that this is a medication that we need to give to the person. The art of it comes in you as a psychiatrist being able to see that this is a potential that this person has.
Wow.
This is how I can give this medication instead of that medication.
Yeah.
So there is an art aspect to it. But even though I do lightheartedly speak about an art, it is quite a serious undertaking. It is quite a serious undertaking for a person to come see a psychiatrist and to say that this is a challenge that I'm having. Please help me with it.
Yeah.
Yeah.
You know, so there's a stigma when it comes to seeing a psychiatrist. And I think for us as African, or I can say Blacks, we have a name called Uyahlanya, you know. And so for me personally, when I told my mom that I'm going to specialize and I want to do psychiatry, and she's like, of all things you could do, why do you want to work with those people? And so how important is terminology in saying things the right way, in helping people to sort of like not feel afraid to see a psychiatrist? Like, you know, I always say people are not afraid to see an oncologist who will tell you have cancer, but they are afraid to see a psychiatrist. So what do you think there is just a misunderstanding when it comes to psychiatry?
Thank you for that. I'll answer that question in two parts.
Yeah.
The first part, I think, has a lot to do with where we come from as a country. We all know that we come from a really brutal history of colonialism and apartheid.
Yeah.
And these two eras of our history were characterized by the majority of people being formally excluded from the economy. And that also includes access to specialized healthcare.
Wow.
When I speak to people, my patients in particular, and we're going through, you know, the history of psychiatry, I say to them, it is not an accident that in townships and in rural areas where we predominantly live, it's not an accident that you will find a GP practice at every corner and you won't find, say, a psychiatrist or other specialists with ease, like finding a GP. And it simply is because, firstly, Black people were excluded from being able to go to varsity. And those that were able to go to varsity and to go to medical school, they tended to be restricted in, you will study up to this point.
Wow.
And if you wanted to study further, there were all of these really, really big hurdles that were put in your way.
Sure.
So that's the first thing.
Yeah.
The fact that we were excluded from specialized medical services, including psychiatry, meant that when you had people that were unwell with mental illness, because there was no help available, these people would become very, very sick.
Sure.
And we would see them in the communities being very unwell.
Yeah.
And so we quickly then, you know, made the link between mental illness and, say, aggression or violence and things like that. And we quickly thought falsely that mental illness equates being very, very sick.
Yeah.
Okay.
Yeah.
The other part of that is that we need to speak about it.
Yeah.
We need to speak about it to our patients. We need to speak about it to society to try to, you know, reverse these unhealthy thoughts and associations that have been made because of history between mental illness and stigma.
Wow. Okay, that was well explained. It's the first time that I'm hearing it like that, you know. So I'm also getting so educated. Thank you. That was brilliant. You know, and so I work in a private hospital as well. And I think one of the things I like asking my patients, I will say, who referred you? And they'll say, maybe my general practitioner. And I was like, what were your thoughts when they told you that you need to go to see a psychiatrist in a wellness center, right? Because that's what we want to call it. And most of them said, I was scared, you know, and I was scared because I thought I'm going to see people in straitjackets, even though, I mean, I specialized with you, there wasn't anything like that, you know, and I will see people walking around like zombies. And so that fear that sometimes is imposed by mainstream media, has actually made people to be reluctant to come and see psychiatrists or to even be willing to be admitted in a wellness center. So can you take us through what people can expect when they go see a psychiatrist? They think we're going to look down at them and we're just going to look them up and down and say, oh, you look schizophrenic here, but that is not how it is. So can you take the audience through a visit to a psychiatrist and how that will look like?
Oh, yeah. Thank you for that. So when a person does come to see a psychiatrist, we will sit down with them and we will do what's called history taking, which is what we call. But for the purposes of your audience, that basically means we'll sit down and we'll ask them a million gazillion questions. We'll start off by asking the person about themselves. Where do they stay? Are they working? Were they able to go to school? And yes, we do that to try to break the ice. But we're also doing that to try get a sense of this person's functioning. So if, for argument's sake, the person comes in and they say they were able to maybe go up to master's degree, but maybe they're not working and they're still living at home with their parents, not because they can't find a job, but because we strongly suspect that something happened along there. So that also kind of gives us a clue that, okay, this person was able to go to school, they went to varsity, they started doing the postgrad, then something happened. So that's the point of that. The other reason that we ask all of these questions is we're trying to get a sense about what the person's emotional space is like. Are they experiencing things that other people are not experiencing, like maybe hearing voices or having certain beliefs? And that's called psychosis. We also try to get a sense, is this person struggling with depression? Are they struggling with anxiety? Are they experiencing maybe moments where they feel they're having deja vu or they feel they're having this out-of-body experience? And the reason we do that in particular is that sometimes there are these, I won't say strange, but unusual forms of epilepsy. As, your audience knows, when a person is having epilepsy, they tend to fall down and their bodies are jerking. But not every person that's got epilepsy is going to do that. Sometimes they're going to experience these strange, vague symptoms. And so the whole point of this history taking is to tease all of these things out. We also use that to get a sense about how their minds are working. We call that a mental status examination. And so we will take the history taking. We will take the mental state examination. Sometimes we might even do small tests within the office to get a sense about how their brains are working. And we do that to reach a diagnosis. Sometimes it's not so clear-cut. And sometimes we then need to do other investigations like taking blood to make sure there aren't any other diseases that are there. Briefly, there are certain infections like HIV, like syphilis, that can pretend to be mental illness when it is not. And then once we put all of that together, we're then able to come up with a diagnosis. And most importantly, at that point, we'll also start speaking to the patient about, this is a diagnosis, this is how it can be treated, if it is treated, because some illnesses can't be treated, or this is how it can be, how it can be controlled.
All right. I think that was very well simplified. So it's not an intimidating process, right? It's a process where we sit, we build a relationship with you, we help you through the process. But like you said, at the end, most of us, because of how we were trained as medical doctors, is that we will prescribe medication, right? And I find that most of the patients struggle with that. So I have had patients and then I'll sit with them and do this history taking. And by the end, sometimes, like you're saying, you can be able to figure out the diagnosis without having to send somebody for a CT scan or do bloods. And so when I tell them this is my evaluation, they're like, there's no way, after an hour of having a conversation with me, you were able to figure out a diagnosis. And I'm like, no, but we are trained like that. Most of the time, we know the diagnosis 15 minutes into the conversation, right? But we will go through everything just to make sure that we don't miss anything. And then we prescribe medication. And so they always ask, do I need to take medication? But one of the most common question I get asked is, when am I going to stop the medication? So I wanted you to take us through the role of medication when it comes to mental health, because not everybody sees it as an illness. People think I'm depressed because I'm going through a rough patch in my life. And so once whatever I'm going through is resolved, then my depression will resolve without me having to take medication. And so what is the role of medication in psychiatry?
Indeed. Thank you for that. I think I'll bore your audience a bit with the little biology 101.
Yes, we need that.
Episode.
Yeah.
So when a person develops a mental illness, we do know that there are these physical changes within the brain.
Yeah.
Let's do stress and let's do depression for an argument's sake.
Yes.
If you think of your brain as a garden, as you know, your garden has to have a gardener, someone that'll come in and they'll, remove weeds, they'll put in fertilizer, they'll, remove parasites and things like that. Your brain has also got a gardener as well, and there's something called BDNF.
Yes.
And we do know that when a person has got a lot of stress, BDNF starts to die off.
Yeah.
And when BDNF dies off, it's like your gardener not coming to take care of the garden.
Wow.
Certain flowers are going to grow, uncontrolled. You'll have weeds, you'll have pests and parasites in the brain because BDNF is not there. There's nothing taking care of the brain itself.
Wow.
And what we begin to see is some parts of the brain actually begin to die off, and some parts of the brain begin to work in a really unhealthy manner. And when we get to that point, then, for argument's sake, depression comes in.
Yeah.
And the only way that the brain can begin to heal itself, the only way that BDNF can start to work again is through medication. So by the time a person is referred to us, it means that there's something that's been going on there significantly enough to cause changes in the brain.
Wow.
And so medication then becomes a necessity.
Yes.
Yes, if they come in early enough, you find that we don't need to give medication.
Yeah.
But because there's so few of us as psychiatrists, by the time they come, it's quite late.
It's quite serious.
And so when a person comes in, we will have a discussion, as you've mentioned, firstly about their thoughts and fears, because those are going to influence whether this person is going to take the medication.
Yeah.
And by speaking to the person, we'll also be able to tease out whether this person has got any myths or unhealthy beliefs around medication.
Yeah.
Some people fear that when we speak about medication, it means this person now is going to take medication for the rest of their lives.
Yeah.
Or it means that this medication is going to change them. It's going to change their personality.
Yeah.
Some people fear that they'll become addicted to the medication.
Yeah.
All of those are myths, and we have to address that.
Yeah.
We have to address that. Then we prescribe the medication to them. And the beauty about being a specialist means that we know that we've got all of these medications that we can prescribe to the person. I can give this medication to that person. And we'll know what to look out for in terms of side effects.
Yeah.
And briefly, I know when I said side effects, someone in the audience, got a bit worried.
Yeah.
Every single medication has got side effects.
Yes.
I think the reason that psychiatric medication is so linked with side effects, I think has got to do with a lot of stigma that we see.
Wow.
If let's use cancer for an argument's sake. If a cancer is diagnosed and the oncologist says, this is what I need to give you, people do know that when they have to take the medication, they might start to lose their hair or they'll start to vomit or lose weight or things like that. But there isn't a lot of resistance to an oncology and medication. Yeah. But with the psychiatrist, because of the stigma and the fears, unfortunately, people tend to be a bit reluctant.
Wow.
So that's why it's really, really essential that we build that therapeutic relationship with the person, that we tell the person that, look, this is what I'm going to give to you. This is what, you should look out for.
Yeah.
And then lastly, to tell the person that fine, here are some resources that you can check out to read, but when you've read, please come back and ask me about it, because some of these sources are not accurate.
Yeah. And I think this helps, because then people will know that as much as I would want to take a chemotherapy and lose my hair, there are side effects, but it's manageable, right? And the aim is to restore functioning rather than to make somebody looks unwell. And sometimes you will have side effects that are not bearable. And most of the time all the time we are able to give you an alternative drug that will help you with the least side effects, right? So that was very, very informative. Okay, so what would you say to somebody who is hesitant to see a psychiatrist? How would you encourage them to seek the help that has been recommended by somebody else? And sometimes they themselves are aware that things are really out of hand and I'm not able to manage life without professional help. How would you encourage somebody to seek professional help?
So I would say, please come. I think if we look at our society in South Africa, all of the warning signs are there that our mental health individually and collectively is not in the best state. If we look at the amount of substances that people are taking, and we do know that people will use substances as a coping mechanism. If we look at the amount of, people using substances, if we look at the amount of aggression that is there, the amount of violence that is there, if we look at the difficulties that people are facing in the workplace, the difficulties that people are having in school, if we look at the amount of people that are dying by suicide, if we look at the statistics, your audience might be aware, but insurance companies in South Africa routinely release statistics that speak about, the numbers of people that are getting booked off work. If you look at those numbers, the numbers of people getting booked off work because of complications of depression and anxiety. And as you know, when someone has got untreated depression, they can actually, in extreme cases, start to look like someone that's got dementia. And those insurance companies are saying that those people that are getting booked off work because of depression and anxiety, those numbers are very high. And those are actually now starting to even surpass things like car accidents or chronic physical conditions. And then lastly, globally, there's something that's called the annual mental state of the world report. And this is released every year. South Africa scores very, very poorly on that score. And there's a study again that was done by a colleague in Stellenbosch, Professor Schoolman. And she reports that people are now, because they can't take off work, they go to work and they stay there. It's something called presenteeism. So the person is there physically, but there's no productivity, there's no efficacy. The company is taking a knock, the country is taking a knock GDP-wise. All of these are really warning signs that, the mental state of this country is not in a good state. And so I would say people must come. If, people do want to read up by themselves, there are lots of really good, resources that are available. The South African Depression and Anxiety Group has got a really good website. People can check it out. Some of the, hospital groups in South Africa, they have also got websites. People can check those out and have a read. But I would say people must come. If the person feels that they are struggling, they're not doing too well, they must come. Or they can start off with their local clinic, or they can go to their nurse practitioner, or they can go to their family doctor, but people must reach out. It's like, an analogy that I give to people is, it's like someone is walking on the street and they trip and they fall and they break their thigh bone. But because someone has said, if you complain of pain, if you're limping, you are weak or you are less than. And so the person stays there with a broken bone, that is really painful and the person can't walk.
Wow.
And because of that stigma, the person doesn't go to hospital and they suffer in silence. And so people must come. The help is available.
Yeah.
It is readily available. People must come.
Great. Wow. That was very nice. So I feel like I'm being schooled, I thought I'm an expert, but I feel like I'm being schooled. So, I feel like people don't have an excuse. I feel like, this is how a psychiatrist look like. This is the conversation that you will have with your psychiatrist. And so I hope that this conversation will help break that stigma, break that fear, and most of the psychiatrists look like Dr. Gago. I mean, he's special. I think you can see, but we do have time to listen and not speak over people, not speak at people, but speak to you and come to your level to help you understand and rise. So in closing, what are the things that you enjoy about psychiatry that can even help the younger generation to pursue psychiatry, because we are very few. All right. And I think the last time I checked, the rate of a psychiatrist to the general population was about 1 to 70,000, And so how can we encourage, the people who are wanting to pursue degrees in mental health or in medicine to consider specializing in psychiatry?
Thank you for that. So there's a dire need of mental health professionals. There's a really, really dire need, from psychiatrists to psychologists to counselors. There's a dire need.
Yeah.
And so I would really, really encourage people to at least investigate it and to consider it as a career path. It is an immensely fulfilling career path. It is a career path that works.
Yeah.
There's nothing as fulfilling as seeing someone coming in with a mental illness. We start the medication and you see the person getting better.
Yeah.
Nothing is as fulfilling as that. And so people should investigate that. And for the general public, I would say that people should read up about mental health.
Yeah.
As I mentioned a few minutes ago, SADC has got really good resources. Some private hospitals have got really good resources. People should read up about those. And lastly, I would ask people to take care of their brains, please.
Yeah.
If there's no brain health, there's no health.
Yeah.
If there's no health, there's no brain health. People must take care of their brains. How do they do that? People must eat.
Yeah.
It's become the norm for a person to wake up in the morning, have a cup of coffee, and you're running off to work without eating. Feed your brain.
Yeah.
In the morning, in the afternoon, in the evening, feed your brain, please.
Wow.
When we're speaking about feeding your brain, more fruits, more veggies, less ultra-processed foods, please. For those people that, are privileged enough to have jobs, please, if you can, every 3 hours, give yourself a little 5 to 10 minute break.
Okay.
When you're knocking off work, I know that, sometimes some people have to stay at work for longer. I understand that. But when you knock off work, you're knocking off work. Go home and get your rest. If you can, do some type of physical activity. If you can go to the gym, fine.
Great.
If you can't go to the gym, some form of physical activity around your home.
Yeah.
What I say to people is, if we can organize stock fails, if we can organize jazz societies, then surely we can organize a little exercise group for us to walk around the neighborhood.
Great.
So feed your brain, rest your brain at work, exercise, and when it's time for sleep, sleep.
Yeah.
You do this, you'll be taking care of your brain. And lastly, if your doctor has prescribed medication for you, maybe you've got high blood pressure, maybe you've got diabetes, maybe you've got cholesterol, maybe you've got HIV.
Yeah.
Take the medication consistently. All of these small steps are going to take care of your brain.
Wow. We're definitely going to have Dr. Gagu back, especially when we dive into specific topics. And so I am very, very honored. It was great having you, Dr. Matsebula, here. I'm looking forward to having more great conversation with you, but this was very enlightening. I wish we had more time to dive into more things, but we just also want to keep a concentration span. I mean, we know the details of a concentration span when it comes to mental health and people getting the most. So we're going to cut it short here, because we are still going to have more conversation with Dr. Matsebula. So thank you so much again for joining us on our Mind Vault podcast. And if you loved it, please subscribe, invite your friends, share with your friends. And until then, love your mind. See you next week.